Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHIL, the Civic Health Innovation Labs.
CHIL's an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bringing innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHIL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as, what are their day-to-day tasks? How did they get into the role that they currently have? And what advice would they give if you are interested in getting into this area of work yourself?
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City region.
Hi everyone, and thanks for joining us for this latest episode of Health Data Decoded with me, Ed Hill.
And me, Samuel Ball.
And today we've got our first guest as part of our Health Data Decoded series. So who is joining us today?
Me. Hi everyone, I'm Seonaid Lafferty. So I'm a Programme Manager on the Data Action Accelerator based at the Civic Health Innovation Labs.
Right, so obviously you're part of the Civic Health Innovation Labs, you're leading the DAA. Can you just explain to us what the DAA is?
Yeah, so the DAA, or Data Action Accelerator, is a collaborative research programme that looks at applying advanced data science to tackle some of our kind of global health challenges. Specifically, we work, it's quite place-based. So we work really closely with the Cheshire and Merseyside Integrated Care Board and the NHS trusts to kind of deliver on the programme overall. But there are two kind of core strands to the programme. One of them is training. And Sam, you know it well because you've done that aspect of it. So that's just addressing some of the skills gaps that we have within the NHS, particularly people in management and analyst roles. But we also engage clinicians on that as well. And we also offer that programme out to local authority generally. So we've also got police and fire in there just to mix things up a little bit. But that just really speaks to another kind of additional need as to why the programme exists as well, which is around the linkage and the connection and not seeing health as a kind of siloed thing, but that it's it is integrated into kind of all other aspects of the social system, and we look at ways to do that and link that up. So the second kind of component is the engineering component. So we've got a team of data scientists and engineers that work to design and deploy innovations and technologies that will help make the NHS more efficient.
And I think it's brilliant. So Sam, you have like an affiliation to or linkage into the DAA. So I myself don't have an active link to it, but it's awesome to hear about how it's using data to then bring benefit to the local region, the city as a whole, and the various different groups that are benefiting from this as well. It's incredible. And so with your role as a project manager within that, so you've already said about the different strands, and so there's various different people and groups that are involved here, so it sounds like quite a big team overall. So in terms of your program manager role, what does that involve, and say like as for the whole project, how many people are actively participating?
Yeah, it's a good question, because I think if we think about Data Action Accelerator sitting within the Civic Health Innovation Labs, that the Civic Health Innovation Labs is a physical place, obviously. It's a hub that brings together clinicians as well as academics and researchers working in that space, but also people in analyst roles and data science roles as well. And there are a number of programs within CHIL. So things like MRIC, which is our mental health program. We've got Dynerics, which looks at creating visual tools. And then we've got kind of additional programs that are very kind of focused on one of CHIL's 4 kind of themes, I suppose. Whereas Data Action Accelerator is a bit more of an integrator. So it's more of a kind of umbrella program where, yes, we have clear deliverables and, we have a clear kind of aim towards, what it is exactly that we're trying to achieve, and how we go about doing that is more the focus, I think, than this sounds like a really slippery way of trying to get out of telling you about my targets that we have, but actually it's more about the system. So a lot of our work at Data Action Accelerator is being that link between the different programs within CHIL. So we have a dedicated team of engineers, like I mentioned, but we also tap into other pools of resource that are available within the university that are working on different programs that have perhaps not so much flexibility with what it is that they deliver, whereas the Data Action Accelerator has an opportunity to pick those up and, the clues in the name accelerate that. So, I think in episode 1, Ed, avid listener that I am, you mentioned about that translation piece, and that's what acceleration is all about. So we've got the research, we've got the capacity, we've got the tools a lot of the time ready. We have the skills that can apply and deploy some of these solutions. But actually it's about finding a way or developing a new model for translating those technologies into different contexts.
Good. At least we have an avid listener. That's fantastic news.
But my kind of day-to-day is everything from project management, the kind of day-to-day tasks around kind of managing risk, mitigating risk, tracking, keeping tabs on the various partnerships and things that we've got as well, cooking in the background. But it's also there's a bit more of a kind of strategic focus on that as well. And because we are that umbrella programme within CHIL, we run a lot of workshops. We lead on a lot of workshops that are regional, that engage people across different programmes around a specific area. So something like polypharmacy is an example for that. We've got the civic data being, the core part of our centre. We've got a number of engagements and projects that we run with third sector organisations and the trust, National Trust as well. So we invite them in, and we do a lot of work around sort of understanding lessons learned and trying pull everything out of those silos, so to speak, and draw it all together and develop a bit more of a holistic or a systems way of thinking about it.
Such an interesting kind of role and department, isn't it, really, CHIL? Because obviously we're pulling people from all different areas of the university. I mean, we've got the electrical engineer team, we've got the data teams, we've got the health data science teams, which I think officially we're all part of the health data science department.
Yeah.
But everything within CHIL is about bringing everyone together to one place so we can work together and make an impact. I was just wondering, so obviously I think in episode 1 we talked about our journeys into data, and they were quite conventional in that we were using kind of mathematicians, and then we learned how to code or do mathematical modelling, and then we did AI from there. But from a project management kind of program leader kind of role, how did you get into this kind of CHIL role, and what was your journey going through?
Quite colourful, I suppose. I'm actually a social scientist, so my PhD is in climate change and adaptation and human behaviour around that. So it's more a kind of mixture of anthropology and climate science, I suppose. But I think that is this is when we think about when we're dealt a kind of huge wicked problem like that, it's a blessing in many ways because it can be applied or relevant to so many different contexts. So when we think about health, we think about, in that context, we think about what the impacts of, climate change is going to have on health inequalities. Also thinking about how, models that and frameworks that we've put in place around that can help kind of facilitate resilience and adaptation can also be applied in kind of health context as well. And again, that thing about kind of linking everything together and seeing it as a full picture. So that's my kind of academic position. So I'm not a clinician, or an engineer. So you can imagine I find myself in situations sometimes where, I just love learning. So I think that helps a lot. I've learned a lot about machine learning over the last 6 months. But I've also kind of worked in, I think what I bring to the role is more around the kind of collaboration and partnership piece. So I've worked in a number of kind of partnership roles, helping to kind of bring people on board. So again, it's that kind of translation is really important, and also trying to get lots of different people working together and framing that in a way that people can see the value for them as individuals and as individual organisations, which is quite tricky to do when you don't have any power, I suppose, to kind of say I don't have a big wad of cash to wave at people. I'm just trying to tell a good story here, and help you to see the value in what it is that we're doing and why it's so important that you're involved. And then prior to kind of working in higher education, I worked in social value. So I do that was a lot of kind of consultancy work. Again, just helping supporting organisations to understand their value in a kind of social context. So we do apply a lot of the principles of social value to Data Action Accelerator. Sam, consciously or not, when you put together your strategy around the training programme, there was kind of those three kind of headlines, wasn't there? So, involve everybody as early as possible, find a way to work together to refine what it is that you're trying to do and think about what it is that you want to measure. So it's that kind of impact, output, outcome triangle, thinking about things that way. This is our statement, this is what we're trying to do, but, it's by involving all these different people and talking through what we've learned and talking through ideas and understanding each other that the real power of kind of getting that done comes from. And then there are other kind of, deeply kind of ethical components to social value as well, which I think are integral for us within CHIL and the university more widely, but also as a society. When we think about, don't overclaim, let's be honest about what it is that we're trying to do and transparent about that, and let's see this as an opportunity to learn and grow together.
That's it, trying to be realistic and honest, transparent.
Exactly.
These are all ideals and values we'd like to strive to try to keep to where possible. And so just reflecting on some of the things you just said, thank you very much for sharing that, and just really showing basically the power of having these different perspectives that then come into these teams. And so it's not the case of everyone is the exact same skill set, and therefore the groupthink might set in is we've got the various different trainings, life experiences, and then as part of then the collective group, that then being shared and discussed, and I think then just add more value and help enhance progress. And what you said about the kind of your own kind of wish to learn, I think that might be a common thing for a lot of people involved in these projects. And I guess that's a commonality between all of us, where it's like we would like to improve the understanding, reduce uncertainty, and it's something motivational. It's motivational, something we're...
It's interesting as well, isn't it? Because I think we come from like a very mathematical, black and white background. I know we've got our own, so within statistics and within clinical kind of mathematics, there's a very rigorous way of doing things. Like you've got your p values and things have to be a certain way. But then I think with AI and machine learning, what we get out of it is a little bit fuzzier. And I think that there's all these ongoing discussions about AI in society and stuff. And I think I can say from my perspective, the AI people don't have that skill set, the kind of ethics skill set to be able to really look into and analyse it in the way that I think we should be doing. And I think that's why it's important to have that broader range of skill sets on board. So that, I've sat in meetings where people have proposed something and someone's gone, well, hang on a minute, like we've got to think about the social impact here. And then everyone's kind of gone, oh, well, yeah, we do, because that's what we're here for. So it's so important to have both of those things, isn't it, really?
Yeah, and it's interesting when, because CHIL does bring together, it's a interdisciplinary centre at its heart, and it does bring together, people from different perspectives. But you do sometimes find yourself kind of confronted with a situation where, because of my academic background, to me, it's more important for me to tell you a little bit about my story and why I am the way I am and why I think the way I think, for you to put that into context, for whatever follows, for you to put that into context. Whereas I think there are some disciplines where that isn't really encouraged. And I think it's important sometimes, remember when I had my interview for this job, and at the end of the interview they ask, is there anything that you... And I asked the panel what it is that what kind of, what's their motivation, like you said, Ed, what gets them out of bed in the morning to go to work, and why do they enjoy working within CHIL? And we had that conversation about, actually, do we spend enough time reflecting on what we're doing and thinking about the whole system and thinking about, yes, it's complex and yeah, we can't solve everything, but at least then, we're on a journey towards a positive change.
Absolutely. So with the role that you have, and so something which hopefully we're being able to convey here is, as part of these projects, there's various people with different roles, and without these roles being fulfilled, then basically these projects wouldn't function properly. So each one is crucial. So with your own role, do you have a typical day-to-day, or the types of activities you do each day, or is it actually very variable from one day to the next? What you...
It is variable. There are things that I have to, I keep track on that are always ticking away. So when we think about those two core components, the training and the engineering, there'll be times when one demands more attention than the other. So, for example, we're just coming to the end of our Population Health Analyst Academy training, which ends next Friday, which has been, fantastic. We've got 240 people enrolled on that programme, with an average of about 100 attending each online session, and then others catching up.
That's brilliant.
So, we do have good engagement, but we're actually thinking about, what next. So that evaluation piece is going to be really core. And I know, Sam's really keen to make that a focus group, not a survey. So let's think about, what's going to that kind of prepared, with a couple of other things in mind. Because this is the other thing, when working on a programme like this, that has so much potential, and in some ways it's, again, a kind of a blessing and a curse. It's huge, and then you try to kind of narrow it down, and then it kind of grows again, and then it seems to be a bit of a cycle of that. But we do have to keep our kind of eye on the kind of the long game with this. So, we do tie this into how we do think about how we align with policy and NHS strategies, so things like Data Saves Lives, the Darcy report, things like that. Whenever these publications come out or new policies are thought up or published, it's our job to kind of keep track on that. And that's not to manipulate the situation or what we're trying to do to align it to that, but it's just to say, right, okay, so this is interesting, this provides a bit more focus, and this also perhaps can give justification for us focusing on this particular project. So with the data engineering strand, we've got a project pipeline. We've got, 4 or 5 projects live that we're constantly kind of developing, so we catch up fortnightly on those, but then there's multiple conversations going on at the same time, because there's the technical engineering, the research aspect, and then sometimes we might need data that we need to go through a process to access that data, and sometimes there might be an opportunity to work with an industry partner or a public or third sector partner to really accelerate what it is that we're trying to do. We don't just want to create something that's going to sit on a shelf. We want to create something that at least we can test, if not deploy. So, we're really lucky with our engineering team in that their approach is very iterative. So we're constantly feeding back. We're constantly asking people, what do you think of this cool thing that we've done? And, giving demos and things like that, and trying to collate that feedback, and then it goes through a kind of an added kind of cycle then at that point of development. So those take up a lot of my time, but as I said, I think the whole system, the health ecosystem part takes up a lot of time as well. So running those workshops, engaging those people, attending events, speaking at events, talking about, disseminating what it is that we're doing, because that kind of knowledge exchange is a core part of what we do as well. So yeah, that's there's lots of things to keep busy. There's
incredible variation from the short term. Ongoing tasks, and like I said, then you've got to the longer term, like horizon scanning, visionary work, which is also crucial happening too.
And funding applications as well, which you're both well versed in.
Absolutely.
So that was what I did in my previous role. So I've inevitably kind of brought that over to this as well. When we talk about what's next, we need to look to that, and we need to understand, what that landscape looks like.
And that's crucial, isn't it? It's like an understanding of where might the landscape be at that point, and therefore is what we're doing. Is that something we can actually deliver? So we can have our big picture, but then is that something we can feasibly do? And then let's say we need to then refine it and package it in such a way that, okay, this is actually, for the next step, this is something we can then deliver, and then we're making the iterative progress to ultimately that overall, perhaps big picture question.
And it's interesting as well, isn't it? Because I think part of it is interacting with the health system and ecosystem as a whole, as you said. And I think part of the problem is, from my perspective, is that because I came kind of into health as a topic, we kind of went from interacting with, the pharmacology work that I did was more, it was with the biological research boards, and I think they're a little bit more relaxed because it's not directly impacting patients as much. It's kind of more upstream. But when I came into the health work, there was such a system around, or systems around, like how we were involving patients, how ethics, all these different things. And having someone to navigate those systems, I think, is so important to understand that we are doing something that is feasible within the health environment we have. I think part of the problem with just how large our health systems are is that it is so hard to understand. So I was just wondering, for our listeners, how can they kind of get more involved with this kind of health ecosystem work? What are some of the ways that they can contribute in making this more understandable?
There's lots of opportunities within Liverpool City region to get involved with the stuff that we do. So, Civic being at the heart of that. And, we had a workshop on Monday, for example, that was just solely on co-production, which included public advisors, which are people with lived experience, asking them, about, how, whether or not, just asking them in the first instance whether or not they feel like, they're genuinely involved in the co-production process, or does it feel more like a consultancy? So we've got a number of events that people can get involved in Liverpool, but from my perspective, like in terms of, from a professional standpoint, I would say absolutely listening to podcasts like this is very important. And it's the first thing I did actually when I found out about this role and I applied for this role. I thought, is there anything that talks about data science, health, linking data, that civic aspect? And I couldn't find anything. It's quite unique. So definitely, thinking about ways that you can engage and understand, because it can be daunting, especially when you're sitting in a room full of clinicians, consultants who, and to find a common language. But I think it's important to go into it knowing that thinking about if you've got a kind of a strong kind of moral code, and thinking about that kind of broader impact and thinking about how you can connect things up. I think that there's lots of opportunity for people from lots of different backgrounds. But, there's been certain things that have surprised me along the way that I didn't realise that, I would have to kind of skills that I would have to develop. And that's not just the technical aspect, but also thinking about things like regulation and compliance. When we're developing some of these dashboards or tools, we need to think about all these kind of questions about whether or not this is a medical device, and what things we need to get in place. And those things, we have to remember that those things are there for a reason. Know that they're not just there to slip you up and to be sticklers, but to make you, again, just really think about what it is that you're trying to do. I think there's lots of opportunities to get involved. There's lots of ways people can get involved, but I do think that, it's about it's not just about what data we collect and how we collect it, but it's about how we translate the data that we have towards those kind of broader outcomes.
Cool. That's awesome. Just to say, thank you for the work that you do. And it's great to be able to be part of this interdisciplinary group with colleagues such as yourself and just seeing this work that's being done. So.
Yeah, it was brilliant. Thank you very much for explaining that. Yeah.
Thank you so much.
Cool. And so thank you very much for listening and watching to our latest episode. And if you would like to rate us, so like and subscribe on your streaming platform, you're very welcome to.
Yeah, and you can follow us on Blue Sky or any other of our social platforms. So that was Health Data Decoded, and we'll see you on the next episode.